Thanks, Mark. Almost a year into the pandemic, no one in Ontario should have to work next to a coworker with a cough or a fever. No student should have to go to school with mild COVID-19 symptoms. But that's what opposition leaders and advocates say what will happen if the province refuses to legislate paid sick days. The Premier was grilled about this today and says it should be a federal responsibility. A growing chorus of voices are demanding provincially legislated paid sick days in Ontario. A caravan of advocates and workers circling Queen's Park this morning to get the Premier's attention as the legislature resumed.
We know that without paid sick days, workers are in the impossible decision of choosing between staying home and following public health advice or going to work sick.
Carolina Jimenez is a registered nurse in Ontario and knows the dilemma all too well.
I don't have paid sick days. A lot of my colleagues don't have paid sick days. A lot of the people in the healthcare ecosystem don't have paid sick days.
And retail workers are in the same boat.
It can have devastating results. Do we know there's a chance we're working with sick people? Yes, absolutely.
In fact, 58% of working Canadians don't have access to paid sick days. That number jumps to 70% for low-income workers. And as an example, in Peel Region, 1 in 4 people with COVID-19 symptoms have been going to work.
It wouldn't be fiscally prudent.
I know that's going to be discussed in legislature today.
But the Premier doubling down today in an interview with Breakfast Television this morning. He says the federal government has already set aside taxpayer money to fund the Canada Recovery Sickness Benefit to provide income to employees who are unable to work because they're sick.
Out of the $1.1 billion the federal government has, they've only spent right across the entire country $319 million. So why would we go double dip into the pockets of the taxpayers when there's a program already in place?
But critics highlighting significant shortfalls in the federal program. For one, it doesn't cover minimum wage, providing workers with a maximum $500 a week for 2 weeks. There have been complaints that it takes too long for the money to show up in bank accounts, and there are also eligibility barriers.
Workers have to have lost at least 50% of their wages for the week before they can apply. With paid sick days, people would just be able to call in and they would get their full income on their next paycheck.
The Premier says he has spoken with the Prime Minister about the issues with the program.
They have to shorten the period until people can get money into their account in days. They already have the infrastructure set up, and maybe increase it more than $500 a week.
In the legislature today, the Ford government refused to support the NDP's call for all-party consent to pass Bill 239, which would provide 7 permanent paid sick days plus 14 additional days during a pandemic. We did reach out to the federal government about some of the shortfalls of their program. In a statement, they tell us there is broad eligibility criteria and the benefit helps workers regardless of where they live in Canada. They also say the benefits are paid to most Canadians within 3 to 5 days of them making their claim. They also add that some jurisdictions like BC and the Yukon have stepped in to provide additional targeted support. The work they have done is not duplicative but complementary, and it should provide a strong example for other provinces and territories on ways to support workers within their own jurisdictions.